Welcome back. Joining us live today is V Season. V is our senior correspondent in the United Kingdom, and she recently recovered from COVID-19. Thank you for accepting this interview, V. This is a time when reports about the incidence of cases of COVID-19 has either risen or have improved. Either way, please share with us your own personal experience in battling the disease from when you had symptoms, what manifested, how you have decided to have a test, and the important events that followed after this.
Hi, Alma. Hi, everyone. So my experience with COVID-19, I was fortunate enough to I went to see my consultant and to have a health check because I'm immune suppressed. And I developed some very light symptoms of runny nose and a slight cough. And the consultant was concerned enough that I had two tests. One was for a common cold and one was for COVID-19. And I was a bit shocked that I got the COVID-19 test, but also fortunate because I wanted to find out if it was a common cold or if it was COVID-19. And you know, I had taken a lot of preventative measures, so I hardly go out of the house. You know, we wash our hands thoroughly, so there was no pinpointing where I had got or where I was exposed to. So that's really important to know. It can come from anywhere. And so after 2 days, I got the results, and they telephoned me and they said that I have tested positive for COVID-19. And when I heard that, I was initially very shocked because when you see the TV reports, you see that people are dying and they can't breathe. So I was so shocked, and even my family was shocked. And then we said a prayer, and after the prayer, we felt fine. And then the doctor kept on reassuring me that this was mild symptoms, and really no one knows what mild symptoms means. During the course of the 2 weeks, which is the initial sort of strong phase of the virus, I was isolated in my room, and luckily, fortunately for me, I didn't have a temperature. I just had a cough and runny nose, and the cough just got stronger. So I just got like a heavy chest. My chest got heavier, and you know, you have no appetite. But you know, God willing, I really got through it. Everyone was really supportive. You know, I had support from my family. Even our whole household was in lockdown. So our family outside, they would bring the shopping to us and just leave it in the door.
I hope it's okay to ask V if you had a medical history of pulmonary or respiratory infections or diseases.
I have no medical history of any lung disease. No. This was totally out of the blue, and luckily it was a very mild symptom. But even though it was mild, it is still a bit scary because you have to take your temperature, make sure you have no temperature, and it was just the cough that was really, it was getting worse and worse. And then afterwards, after 2 weeks, it's gone now. And I feel fine. I'm getting my energy levels.
Were the symptoms and ensuing conditions different at all from a flu?
I think so, because with the flu, you keep on sneezing. With this one, my chest got a bit heavy. It's like there was something pressing on my chest.
Was it painful?
No, I think you just need to be calm and not panic, and just remain stress-free. You know, watch all the movies, do your makeup, sort out your wardrobe, you know, just have a very positive outlook.
Uh-huh.
And I think you will get through. I think if you think about, you're getting sicker, then that will not contribute to your well-being. But if you keep positive and do things, read, learn a new skill.
Mm-hmm.
I tried to learn a new skill.
Mm-hmm.
So that really helped me spend the days. Really.
Were you among the first few patients over there?
Um, I know that when I was in the hospital, they told me I was waiting outside. I think I was one of in the first week. I was at the same time as Prince Charles when he was
Mm-hmm.
announced. So I was at the same time as Prince Charles.
Uh-huh. Okay,
But yeah,
so
it was.
yeah, how would you describe the readiness of the hospital there and the health staff in meeting the volume of the patients?
So I got a letter from the NHS, which I was really surprised. I got it quickly, and there's a lot of telephone support. So I get regular phone calls from the NHS. They actually rang me to check if I needed a helper, if I needed someone to fetch my medicines.
Mm-hmm.
And they were really supportive via telephone, and they would offer those services. But fortunately for me, we have family around, so I didn't want to take away those services from other people.
Are you still under quarantine?
We're still under self-quarantine in the garden because it's really nice weather, really lovely weather here at the moment.
But you can now, like, talk to your family face to face. I mean, social distancing, yes, but did
Yes.
they were
Yes.
you advised not to get close to them? Did they tell you if you're already immune, or you cannot get, you have immunity for COVID-19 did they tell you anything at all? What did they
So,
tell you?
so for 2 weeks I was quarantined in my room, and now I'm out of my room, and it's really nice weather. They did say that the whole family should be quarantined. And then next week, I have an appointment with my consultant, and I think I'm going to be tested for the antibodies.
Antibodies. Can you tell us about that? What are they going to do with the antibodies?
They're just going to check if I've developed, because I've had COVID-19 now for 3 weeks. I think
Mm-hmm.
it's passed through my system.
Mm-hmm.
So now I'm going to have another checkup, and they're going to check if I've developed antibodies against COVID-19.
Mm-hmm. Is that going to be painful? Do you know?
I
I hope
know it's
not.
just going to be yeah, I think it's just going to be, because every time I go to the hospital I have a blood test.
Uh-huh.
So they're just going to draw blood and just check.
Mm-hmm.
So yeah, it's not that painful.
Has the government provided some form of financial aid for COVID-19 patients, like or like for those who have recovered, like you?
There are some benefits
Mm-hmm.
for people who have COVID-19. So you can claim from the government, but as I'm still employed, I can't claim for that. But there are benefits for people who have COVID-19. People
Mm-hmm.
just have to apply. Yeah.
Mm-hmm. So it's not painful. It's just a heavy feeling on the chest. Because some have described it as really painful, but I guess you're more relaxed, I guess. So you didn't
Yeah,
really.
you just have to be calm and patient, um, and just chill out. I think that's the best. Not to be
Everybody has to chill
concentrated.
out, actually. Yeah.
You
Mm-hmm.
just need to chill out and not. But yeah, luckily for me, my symptoms are really mild.
Mm-hmm. So now that your condition has improved, what do you hope people will take away from this experience?
So if they have tested positive from COVID-19, I hope that people don't panic. I think that's the worst thing you can do, is panic and think that you're going to deteriorate really quickly. So I think it's just to remain calm, pray, and really just think of the positive things, because after you've had this illness, then you'll have the magical antibodies and you can go anywhere.
All right. So thank you for sharing this significant experience and with us and the public. None of us will come out the same after this. Thank you. To someone like you, we might come out more patient, as you said, and understanding, more relaxed in
More
relating to
relaxed.
crisis such as this. Thank you so much, V. Please stay
Yeah.
healthy.
Okay. Thank you. Thank you, everyone. Stay safe.